How is a colposcopy performed for cervical cancer screening? Imagine a routine check that can help catch cervical issues early before they become serious. That's what a colposcopy is all about. It's a detailed exam used to look closely at the cervix, vagina, and vulva, especially after abnormal Pap test results or positive HPV tests. This procedure helps identify precancerous changes or early signs of cervical cancer, making it a vital part of women's health care. The process begins with the patient lying comfortably on an exam table, with knees bent and feet placed in supports or stirrups. This position gives the healthcare provider easy access to the cervix. Next, a speculum, which is a smooth, tube-shaped instrument, is gently inserted into the vagina. It holds the vaginal walls apart, allowing a clear view of the cervix. The speculum stays in place throughout the exam. Outside the vaginal opening, the provider positions a special instrument called a colposcope. This device looks like a binocular microscope with a bright light, but it does not go inside the body. Instead, it stays outside, magnifying the view of the cervix so the doctor can see any abnormal areas in detail. To make abnormal areas easier to spot, the provider applies a mild solution to the cervix. Usually, this is acetic acid, which is similar to vinegar or sometimes iodine. These solutions cause abnormal cells to turn white or change color, standing out under the colposcope's magnification. The doctor carefully examines the cervix, looking for suspicious spots that might need further investigation. If any abnormal areas are identified, the healthcare provider may take a small tissue sample called a biopsy. This is done with a tiny punch tool or by scraping the lining of the cervix. The biopsy might cause some mild discomfort, like a pinch or cramping similar to menstrual cramps. The entire procedure typically lasts between 15 and 30 minutes. After the biopsy, some light bleeding or cramping may occur. It's common to notice a brown or black vaginal discharge afterward, which is due to the vinegar solution. Patients are usually advised to avoid inserting tampons, douching, or having sexual intercourse until healing is complete, often for a few days. Pain relief options include taking over-the-counter pain medications before the procedure or using local anesthetics if needed. While some discomfort is normal, most women find the procedure tolerable and not overly painful. A colposcopy is a safe, outpatient procedure that plays a crucial role in early detection of cervical abnormalities. If abnormal cells are found, treatments like the loop electrosurgical excision procedure may be recommended to remove the problematic tissue and prevent progression to cancer. It's important to remember that this procedure follows established medical guidelines and is performed by trained healthcare professionals. If you're scheduled for a colposcopy, discussing any concerns or questions with your doctor can help you feel more comfortable and informed about your health.